Maryland lawmakers plan to introduce new legislation that would establish family and medical leave insurance in the state of Maryland. Sean Stryker explains what that means for you and why it was so important for one delegate.
Maryland State Delegate Chris Valderrama knows what it's like to be questioned for taking leave to care for her children and aging mother.
Even though I had to leave both vacation and sick and had put in the proper forms and documentation and had received approval, at one point, not just myself, but other colleagues of mine at our job were questioned as to why I had used such an extensive amount of leave.
Valderrama is joining Senator Antonio Hayes from Baltimore City to sponsor the Time to Care Act, which establishes a family and medical leave insurance program through which employees may take up to 12 weeks of paid leave in Maryland.
Unpaid leave forces too many Americans, especially those whose needs are the greatest, to choose between income and family self-need.
A recent poll shows a high level of support for the bill amongst voters.
It's unusual in today's climate for us to see a level of support this high. 61% of people strongly support this proposal.
The funding would come from both the employer and employee. It's estimated to cost the employee $3 to $6 a week, which would come as a payroll deduction.
That's reason one, that this has good support, because the cost is reasonable.
And lawmakers say the pandemic only increases the need for this type of legislation. The Time to Care Act will be introduced in the 2021 legislative session. Sean Stryker for WJZ.